Welcome, wizards, to part 2 of Unit 3 on communicable diseases. What is the cold and flu? The flu is a contagious viral illness caused by the influenza virus. Humans are usually infected with human influenza virus from other humans, and occasionally, humans are infected with an animal influenza virus. What are the symptoms of the flu? Fever, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, and fatigue. Some people experience vomiting and diarrhea, and symptoms begin 1 to 3 days after being exposed to the virus. Complications caused by the flu include pneumonia, ear infections, sinus infections, dehydration, and worsening of chronic medical conditions. Symptoms may last up to 1 week or longer. How common is the flu? Every year, the seasonal flu causes thousands of hospitals, admissions, and deaths. Flu is common in winter. Who can get the flu? Anyone can get the flu. Some people are at higher risk of serious health problems when they get sick with the flu. These people include pregnant women, infants, the elderly, and people with chronic health conditions. What is the treatment for flu? Specific treatment for influenza will be determined by our healthcare provider, because some things you can do to remedy symptoms are get plenty of rest, drink lots of liquids, eat healthy food. Over-the-counter pain relievers can help individuals feel more comfortable. Children and teens less than 20 years old sick with the flu should never take aspirin or aspirin-containing medications without consulting your healthcare provider. There are medications available for individuals at high risk of serious health problems, which health care providers use to treat the flu. How is the flu spread? Flu is spread from person to person by direct contact with an infected person or through the air from coughing and sneezing. The incubation period, or the time between exposure to flu virus and start of illness, is estimated to range from 1 to 4 days, with an average of 2 days. Once infected, the virus is shedding during the contagious period, which lasts for 7 and 5 days after symptoms begin. How is the flu prevented? The best way to prevent illness is by getting vaccinated. Influenza vaccination is recommended yearly for everyone 6 months and older. Get flu vaccine yearly. Wash hands often with soap and warm water. Use tissue or upper arm when you cough and sneeze. Dispose of the tissue in a covered trash bin. Clean shed items. Avoid crowds. Avoid people who are sick with respiratory illness. Exclude children with respiratory illness from daycare and school. And stay home for at least 24 hours after becoming fever-free or finishing medication if you're ill with the flu or any respiratory illness.